Hi, my name is Rista Ye, and today I'm doing my presentation on the Centers for Medicare and Medicaid. In 1945, President Harry S. Truman brought to light the need to create an insurance fund open to all Americans. The plan President Truman envisioned would provide healthcare coverage to individuals of all ages to pay for expenses such as doctor's visits, hospital visits, laboratory services, and nursing care services. Congress passed several bills extending Social Security benefits throughout the 1950s, but excluded the elderly population who were considered high risk. President John F. Kennedy also recognized the need for a health care program for the senior citizens, but it wasn't until July 30th of 1965 that President Lyndon B. Johnson signed the Social Security Act, also known as the Medicare Act, into law. The Centers for Medicare and Medicaid Services, CMS, is a federal agency that administers the nation's major healthcare programs, including Medicare, Medicaid, and CHIP. In 1977, the federal government established the Healthcare Financing Administration, HCFA, as part of the Department of Health and Education and Welfare. The HCFA was later renamed the Center for Medicare and Medicaid. The agency's goal is to provide a high-quality healthcare system that ensures better care, access to coverage, and improved health. Medicare consists of four parts titled A, B, C, and D. Part A covers inpatient hospital care, skilled nursing, hospice, and home services. Part B includes physician visits, laboratory testing, outpatient, and preventative care. Part C, or Medicare Advantage, is a combination of Parts A and B, and Part D covers prescription drug benefits. The original Medicare program included Parts A and Part B. Today, these two parts combined are called the original Medicare. Over the years, Congress made changes to Medicare to allow more people to become eligible. The programs of all-inclusive care for the elderly was developed as a response to the growing needs of older adults. The goal of PACE is to prevent the need for extended hospital stays and nursing home care. According to OnLook Lifeways 2019, the PACE model is centered on the belief that it is better for the well-being for seniors with chronic care needs and their families to be served in the community that they live in whenever possible. According to the OnLook website, in the early 1970s, PACE was developed by OnLook, a senior services nonprofit based in San Francisco, California. In 1972, OnLook opened its first adult daycare to support frail elderly populations. The model was expanded in the late 1970s to include complete medical care and social support and allowed reimbursement from Medicare for all outpatient health and health-related services. In the 1980s, inpatient services were added, including skilled nursing care and acute hospitalization. Due to the success of the initial model, Congress extended OnLook's waivers to allow them to expand to 10 additional sites. In 1990, OnLook received Medicare and Medicaid waivers to become the Program of All-Inclusive Care for the Elderly, or PACE. The Balanced Budget Act of 1997 established PACE as a permanent part of the Medicare and Medicaid program. The PACE program provides in-kind benefits, which includes access to general practice physicians as well as medical specialists. According to Kirst Ashman 2017, an in-kind benefit is virtually any benefit other than cash. PACE provides comprehensive services to fit the needs of individuals regardless of the severity of their illness. PACE provides on-call physicians available 24 hours a day, as well as nursing home care and skilled inpatient rehabilitation care when needed. Although the PACE program does not provide public assistance or cash benefits, it does use a means test to decide if an individual qualifies for its program. In order to qualify for PACE, an individual must have an income under 300% of the federal benefit rate, which in 2019 was $2,300 a month. According to Gross 2004, PACE programs were created for individuals that are 55 years old or older, need consistent care in daily living activities such as bathing, walking, eating, etc., and qualify for both Medicare and Medicaid, as well as living within a PACE service area. Before PACE was introduced, individuals would often pay for multiple treatments separately through Medicaid or Medicare. PACE made the process more efficient by combining funds from Medicare and Medicaid through one fixed prearranged monthly payment. This allows PACE to deliver all services participants need rather than limited to treatments covered under Medicare and Medicaid fee-for-service systems. In exchange, PACE organizations assume full financial risk for all the care of their enrollees. According to the American Council on Aging, the application process for PACE is voluntary and enrollment continues as long as the individual would like, regardless of a change in health status. Most individuals learn about PACE through word of mouth and apply by calling their local Medicaid or Medicare office. First-time applicants will be asked to fill out an initial application and to set up an appointment to receive an evaluation by the Interdisciplinary Team, IDT. The IDT team consists of an administrator, doctor, nutritionist, home care coordinator, director of adult care services, social workers, a therapist, an occupational therapist, and others. The IDT team makes all the decisions together on every aspect of the patient's life. And if there's any disagreements, then the team must discuss their concerns and move forward on a united front. As with any other program, PACE has both its pros and its cons. According to Sloan 2014, interviewees were asked about their experience with the PACE program and reported that adverse medical outcomes were especially common with frail individuals that received supposedly routine invasive procedures. Mistakes were often made in the care of patients because of pressure from families regarding the individual's potential for recovery. PACE also suffers from a lack of consistent roles for healthcare professionals. Registered nurses in the PACE program were frustrated in the midst of constant reorganization of the nursing structure and confusion in a fragmented system. But the PACE program also has its supporters. According to caregiver Luca Livius, the PACE program allows patients who require a nursing home level of care to still live at home and allows a caregiver to get paid while caring for their loved one. The PACE program allowed Olivia's husbands to attend adult daycare twice a week for 3 hours, and while he was there, he received physical therapy, speech therapy, and occupational therapy. Breakfast and lunch were also served. Not only did her husband receive the therapy that he needed, his physician was also located in the center, and he was able to get all his lab tests done while he was there. PACE provided the transportation to and from the center for the daycare as well as complete coverage of all of his medications. The PACE program is praised by most who take advantage of its benefits. However, there are gaps in the program. There are only 129 PACE programs in 31 states, and because there's so few available, it can take up to 9 months to apply and get approval. Most clients served by PACE are heavily reliant on medical care. However, seniors must give up their primary care physician and use a PACE-preferred doctor instead. Audits are conducted for trial PACE organizations annually and biannually for established organizations. The audits include reviews of data and documentation submitted by the PACE organizations, reviews of the PACE organization's systems, operations, and documentation of case files, interviews and observation of staff activity. Scores for each audit are determined by the number and severity of non-compliant conditions found during the audit. Lower scores mean a better audit performance. Audits are divided into 3 different categories. A CAR, corrective action required, is a system deficiency that must be corrected but can wait until the final audit report is issued. An ICAR, immediate action required, is a systematic deficiency that is so severe that immediate corrective action is required. These type of issues pose immediate threat to participants' health and safety. Observations are conditions of noncompliance that are not systematic. PACE provides a wide variety of care for the elderly population while still allowing them to stay at home. There are still issues such as the amount of PACE programs available nationally, as well as cost and organization. However, it is a good idea that could potentially allow older adults the ability to maintain some level of independence while they receive the care that they still need.